Hello, everyone. Welcome to Public Monologue. Before I start, I want to let everybody know, please, if you have not subscribed to our YouTube channel, please do so, subscribe and click the alert so that whenever we post either a monologue or roundtable discussion podcast, you can be able to get the information right to you. I really appreciate those that have already subscribed to the YouTube channel. Thank you so much for your subscription. Please make sure that you also share the link with other people so that they can also benefit from our podcast. Now, the focus of this monologue is just to talk about the underlying cause of death, both in the United States and also globally. I will focus on the top 15 cause of death in the lens of epidemiology and clinical data. But also, I want to make it clear that the word cause is deeper philosophical term than the word correlation. The term cause from epidemiological or clinical lens simply means that the event is spatial temporal to the predictive variable prior to the outcome. In other words, the predictive variable created the outcome or outcomes. So that's the kind of like the high level interpretation of causation, but I'm not going to go into deeper philosophical term and nuances of causation. But take it however you want to take it. But the take-home message here is that I will be talking about the top 15 causes of death in the United States and globally. And perhaps maybe you can learn one or two from this discussion, and maybe it will help you to, not just understanding those health conditions or diseases, but also inform you making better life choices. So here are the variables. So here, the predictive variable are the list of the 15 diseases or conditions or incidents, and the single overarching inevitable outcome is death. This is something that we all face at some point in our life. However, we also globally have what is called life expectancy. So each country has their life expectancy, and this life expectancy is based in multiple parameters that either help population within a given location to have a higher life expectancy, better quality of life, and so forth. And then when you look at other countries and compare the life expectancy, you can also see that some countries are close in terms of their life expectancy, while some countries are really far away in terms of life expectancy, meaning that there's ones that are higher and there's ones that are really, really low in their 40s and 50s. So, but also some of these top causes of death are major predictive variables that either will lower life expectancy in a given region, or if controlled very well, will improve life expectancy. So here we go. The list of top 15 causes of death in the US in the order of most to least frequent is as follows. Number one, diseases of the heart. There's different types of diseases of the heart. This is number one leading cause of death. Number two leading cause of death is malignant neoplasm, which is another word, cancer or cancers. And then number three, interestingly, is accident. Accidents is number three leading cause of death. This include also unintentional injuries. Number four is cerebrovascular diseases. Number five is chronic lower respiratory diseases. Number six is Alzheimer's disease. Number seven is diabetes. Number eight is nephritis and nephritis. Number nine is chronic liver disease and cirrhosis. Number 10 is COVID-19. I know that this data the information I'm sharing is between 2018 to 2023 data. Yeah, we know what COVID-19 did since 2019 to at least it went down as of 2022. So it's still in here as number 10, leading cause of death. Number 11 is intentional self-harm or suicide. Number 12 is influenza and pneumonia. Number 13 is essential hypertension and hypertensive renal disease. And number 14 is septicemia. And number 15, last but not the least, is Parkinson's disease. So for the United States, if I look at this list that I mentioned, the question will be, why is this information important? Because knowing the leading causes of death will help individuals make informed decisions for their quality of life and life choices. I also think that people should know their risk to actually prevent premature death to improve life expectancy overall. And I believe that most of people's life and quality of life are in their hands, except for disease or conditions caused by genetics. Most of the leading cause of death are informed by lifestyle choice and social determinants. So we have to start paying attention to our choices and lifestyle. So if we can make informed, healthier choice, we can sustain quality of life. So that being said, let me also share what I just discussed is this. So you can and see for the United States, the top leading cause of death is, just as I mentioned earlier, disease of the heart. You can see that malignant neoplasm critical cancer. You see the bar right there. It's not in the order of most death. Data on the right is just not in that order. But if you look about global death, it's also shown for global cause of death is heart disease. Then you come in here with cerebrovascular disease, which is stroke, and then you looking at chronic obstructive pulmonary disease, lower respiratory infection, and then COVID-19 globally came fifth, while in the US it came at number 10. Then obviously Alzheimer's disease, then diabetes, kidney disease, chronic liver disease and cirrhosis, diarrhea disease, trachea, bronchus, and lung cancers, tuberculosis, HIV and AIDS, Road injury accident here is number 14. Uh, And when we looked at the the other information, accident was higher in the United States. It was at a higher level. Then you have preterm birth complication and neonatal deaths. That's global data. But I also looked at the US, overall US leading causes of death, and compared to California, which is where I live, and between the United States and California, California reflected similar order of, like I stated earlier, just like the overall US causes of death, the similar is still heart disease, followed by malignant neoplasms. And then, when I looked at leading cause of death, structured it based on race, heart disease is the highest among Black. When you look at white, it's also heart disease is the leading cause. For Asians, the leading cause is actually cancer, malignant neoplasm, followed by heart disease. When you look at other racial group, American Indian, heart disease is leading, followed by malignant neoplasm. When you look at Native Hawaiian and other Pacific Islander, heart disease is leading, followed by malignant neoplasm. And when you looked at more than one race, also heart disease is the leading, followed by malignant neoplasm. Only Asian racial group that you see where it was actually cancer first, followed by diseases of the heart. So that's the information I wanted to share today. Please know your risk for these adverse health conditions or events so that you can start making better lifestyle choices and also lifestyle changes to make sure that you mitigate the risk factors for all these adverse health conditions. So, this is where I'm starting this year. Thank you, everyone. Enjoy this video. When you get this video, please share with other people, family members, friends, and please subscribe to our YouTube channel. Thank you and have a wonderful day.